really want to thank you for the invitation to be here today. I want to start with just a simple point, which I think President McCarl set up very well. Indigenous peoples are advancing our rights across many different areas within the UN system. Health, biodiversity, intellectual property, culture, and economic systems. And all of these areas directly reflect our health and well-being as Indigenous peoples. For us, health is not separate. It is connected to land, water, food systems, culture, and governance. So in every space, we're looking at what protects our health and what puts our health at risk. Indigenous health is already discussed in many international spaces that we see, including WIPO, intellectual properties, the Convention on Biological Diversity, the WHO, WEF, and many other entities that are within the UN system. But these systems often work separately. They don't reflect how Indigenous systems work or think about health as a connection together in a holistic way. Plant knowledge is often at the center of this issue. So for Indigenous peoples, plant knowledge is not just about intellectual property, biodiversity, or medicine. It is a system that connects health and it connects governance, culture, and economic well-beings. Because of this, agreements like the WIPO Treaty on Genetic Resources and Traditional Knowledge are extremely important. But their success really depends on one key question. Will they be implemented together with other systems, or are they going to be implemented in isolation? Today, I want to focus on three separate points. One, how plant knowledge functions in Indigenous systems. Two, the risk of fragmented policies. And three, why coordination through frameworks like the Indigenous Determinants of Health are absolutely essential. And I'm sorry, I didn't tell you to change slides. So I think we go on to the next slide now, slide 3. Thanks. For Indigenous peoples, plants are not just resources. They're our relatives, they're our medicines, and they're part of our governance systems. They are connected to land and territory. Plant knowledge is held and protected through collective stewardship, passed down across our generations. Traditional medicine is not a product or sector. It is a living health system. It is sustained through relationships between people, land, and knowledge. Plant systems are also support Indigenous economies. They sustain livelihoods and biocultural economies, which are often not recognized in these global systems. When these systems are disrupted through biodiversity loss, restricted access, or appropriation, the impacts are not isolated. They affect health, culture, governance, and economic stability at the same time. The Indigenous Determinants of Health framework helps explain this. It shows that land and governance and knowledge systems and economies all work together as a foundation of holistic health for Indigenous peoples. This means that control over plant knowledge is directly linked to health system integrity and to economic self-determination for Indigenous peoples. Many medicinal plants cross borders, we know this, and they're governed through relationships and responsibilities, not through ownership, which I'm sure Linda will talk more about. This does not align well with global systems that separate biodiversity from intellectual property, from health, and from economic situations. So when biodiversity is lost, it's not just an environmental issue, it is the loss of health systems and economic systems for our Indigenous peoples. This reality must guide how international agencies work with Indigenous plants and Indigenous plant knowledge. Okay, next slide. Today, Indigenous issues are addressed across many UN agencies, but often in isolation. For example, intellectual property is dealt with at WIPO, biodiversity at the Convention on Biological Diversity, health and pathogen sharing at WHO, as well as the Global Traditional Health and Medicine Center. There is economic systems within the WEF, which we'll hear more about as well. And these processes often move forward without coordinating between each other. For Indigenous peoples, this creates a burden. We must engage in many separate systems, often without the resources to do so. In fact, President Sharp and I were talking right at the beginning of this very issue about some major things that are happening in spheres she's working at specifically that I haven't heard about, but could be really affected positively by thinking about Indigenous determinants of health as a holistic system. We must engage in these separate systems without the resources to do it. And agreements like the WIPO Treaty show both opportunity and potentially risk. If Indigenous peoples are not included as decision makers, not just consulted, then our role is limited. There are also risks with new systems, such as disclosure requirements and databases and traceability systems. Without Indigenous control, these can turn our knowledge into data that others can use. This can weaken our protections that have taken years to build. Fragmentation creates these gaps across systems. It allows weaker standards in one system to undermine stronger protections in another system. This can lead to what we call a race to the bottom. It can also result in legal compliance without real protections, continued appropriation without formal systems. There's also a risk to data sovereignty. If Indigenous monitoring and controls are not included, we lose control over how knowledge is used. These issues directly affect our sovereignty, our economic equity, cultural continuity, and health systems. If agreements like the WIPO Treaty are implemented alone, they may reinforce fragmentation instead of solving it. To prevent misappropriation, we need coordinated systems that reflect how Indigenous knowledge actually works across all areas, not in isolation. Next slide. Coordination across agencies is not optional, it is absolutely necessary. Plant knowledge already connects many systems, including FAO Plant Treaty, the CBD Nagoya Protocol, the WIPO Treaty, like we said, the WHO Pandemic Agreement, the Law of the Seas, the High Seas Treaty, the WEF, and the UNFCCC climate processes. The fourth study that we presented here on Indigenous determinants of health shows that these are interconnected systems. Health sits at the center. When agencies work separately, it creates duplication, gaps, inconsistent protections. We need alignment across these systems, for example. WIPO must align with CBD frameworks like Article 8J. Access and benefit sharing systems must work together. WHO engagement is critical, especially on traditional medicine and new global health agreements. We must also engage with institutions that may be difficult to work with. This includes areas where Indigenous systems are not well understood, but engagement is necessary to protect our rights. Economic systems, such as those discussed at WEF, must recognize that Indigenous plant systems are real economies, not informal or secondary. Climate and biodiversity finance must be aligned so they do not create new pressures on Indigenous lands and knowledge. Across all systems, the UN Declaration on the Rights of Indigenous Peoples must guide implementation, and this includes FPIC, self-determination, and data sovereignty. From our perspective, coordination is not administrative, it is protection. Without coordination, rights can be weakened through inconsistency. We cannot sacrifice consent for speed or innovation. The Indigenous Determinants of Health Framework offers a solution. It's already recognized in the WHO and in the CBD processes, and it provides ways to connect land, knowledge, health, and economic systems. This allows for implementation that reflects reality. In the end, the success of agreements like the WIPO Treaty will depend on whether they are implemented within a coordinated system. Strong Indigenous leadership is essential right now for the globe, and at the Indigenous Determinants Health, we're here to help. So, thanks.